Hey there, Greg with Mountain Physical Therapy. This week we're going to talk about the squat. Now if you haven't watched our previous videos talking about core stability, hip hinging, or strengthening your hips, go back and watch those as they'll be very helpful in giving you pointers when we are talking about the squat. Now one of the most common movement faults I see with the squat is having too upright of a torso. When people sit back into a chair, if their trunk is too far upright, their knees are going to come forward and their heel is going to rise. We want to try and get away from that movement pattern and use our hip hinge, get the weight further on their heels or in the posterior. So as Ryan sits back onto the box, his weight's going to go posterior, his foot is going to stay flat, and he's going to come upright. The second part to having too upright of a torso is the ankle joint. If your heel is coming up, you're having your weight on your toes as you're squatting down, the problem might be a lack of dorsiflexion in your ankle. Band mobilization I like to use is having a band attached to a low anchor, putting your leg inside of the band, and then having a riser. This is 4 inches, doesn't have to be very high. But the key is to make sure the band is low enough onto your foot or just below the ankle crease. So I'm gonna move this band low enough to where it's on Ryan's foot. Once he's in this position, he's gonna have his knee translate forward, keeping his heel down on the step. The band is going to help pull the talus or the foot bone back into the joint, allowing for more dorsiflexion. Another movement fault with the squat is having the knees come too far in when we're squatting down and coming up. This is what we call knee valgus. This can either be a weakness at the hips or weakness at the foot or ankle. So when it's the ankle, the arch is going to collapse. So when Ryan talked about gripping the ground and have a tripod foot, we really want to make sure our heel, ball of our foot, and the lateral portion of the foot are in contact with the ground. That's going to just help engage the foot and foot intrinsic muscles to keep the arch supported. Moving up the chain into the hips, one of the movements that I like to do as a warm-up is having a band around the knees as you're practicing the squat movement. Before we want to exercise, we want to try and warm up all the muscles that we're going to utilize in the squat movement. So having a band pulling his knees in is going to help him actively engage his lateral hip muscles to keep his knees pulled out. So when he takes the band off, the muscles that are going to prevent knees coming in, they will be engaged and working, and he'll have a good hip stability. Thanks for watching this video on common issues with the squat. I hope you found it helpful, and we'll see you next week. Thanks.